Next speaker is Dr. Shruthy RAMESH, please.
All right, good afternoon and all. So I think I'm kind of presenting a bit of a controversial topic. We always have a debate whether to do an immediate sequential bilateral cataract surgery. So this was one of a study we did comparing both phacoemulsification and manual SICS outcomes. So basically to evaluate whether it's safe and whether the outcomes are worth doing an ISBSC in terms of phaco and SICS. So it was a retrospective study. We collected the data for the past 30 months. It was done in a tertiary eye care center. The inclusion basically anyone with a visually significant cataract and aged over 40 years. But the exclusion criteria, we made sure we were stringent about it because we did not want any complicated cataracts, any extreme axial lens, which can lead to further complications later on in terms of retinal detachments or corneal pathologies causing decompensations. So we made sure we also did a good specular count, and any less than 1,500 cells were not included in the study. And patients also requiring combined procedures were not included. So what we realized was if we had good validation guidelines for biometry and good intraoperative planning, it was very safe to go ahead with the procedure. So patients with who were able to do optical biometry, we did with LensStar, and the formula we used was the Barrett Universal 2. But for patients with dense cataracts, we went ahead with the immersion biometry, a manual keratometry, and the SRKT formula was used. And the intraoperative protocol was each eye was basically looked at as like a different patient. So we made sure that the autoclaving was of a different batch and different surgeons performed for different each eye. And all patients had intracameral antibiotics provided. So it was done by 3 surgeons overall, and we documented all the intraoperative, postoperative complications and the outcomes. So a total of 1,306 eyes were included in the study, and the distribution between both groups was almost more or less equal, with phaco having 56%. So what we did with the outcome was we did for a 1 week and a 1 month analysis, and what we realized was the spherical equivalent. We kept that good spherical equivalent outcome was plus or minus 0.5 diopters, and almost 95 to 96% of them achieved that at 1 week. And it was similar again with the manual SICS as well as the phacoemulsification. Same for 1 month. If you see that it did not change much and it remained stable. So the difference between the two groups was not much significant in terms of the spherical equivalent. Target refraction was achieved. And the complication rate, again, amongst both the groups. So what we looked at was the PCR striate keratopathy, which was, again, just intermittent, and post-op iritis, cystoid macular edema, and iris prolapse. And between both groups, more or less equal. And the numbers were also, again, within the limited range. So in terms of vision threatening complications, I know PCR is something that we all look at as the dreaded one in cataract. So what we kept as a rule was if the first eye had a PCR, we did not go ahead with the second eye surgery because again, risk of end-off increases. And in the number of patients that we had the PCR, 2 did not have vitreous disturbance, so we placed the IOL in the back, but 3 had vitreous disturbance. So anterior vitrectomy was done, and was IOL, 3-piece IOL was placed in the sulcus. One patient did have bilateral CME. They were a known diabetic, but again, it was managed just with topical steroids and NSAIDs. And a few people also had striate keratopathy, again resolved with extra antibiotics and NSAID and sodium chloride drops. Bilateral iritis and unilateral iritis was also noticed, but again, it resolved quite quickly. Iris prolapse was noticed in one patient where we had to reposition and suture the wound. It was noticed in manual SICS. So we did a comparison with all the previous studies that had did the immediate sequential bilateral cataract surgery, and it was comparative in terms of the outcomes of endophthalmitis, posterior capsular rupture, and retinal detachment. We did not have any end-off or any retinal detachment in our patients. So overall, there were no sight-threatening complications. We did not have anything related to end-off because of the stringent intraoperative protocols. But we did notice that 30 eyes had a spherical equivalent greater than plus or minus 0.75, but we did not do any toric implantation, and the 11 of the eyes we did were manual SICS, so we couldn't really factor in that aspect. So pre-op astigmatism was not addressed in this study. And comparative again with the spherical equivalent, what we noticed was with the other studies comparing, ours was also of an equal outcome. So more or less 99% achieved less than plus or minus 1 diopter spherical equivalent. So it is easy to achieve target refraction if we have a good validation guideline. And this was one of the 6 largest study done globally, and first to compare manual SICS with phacoemulsification. So as I told initially, if we consider each eye as an individual and autonomous eye, it's going to be safe in terms of infective outcomes. Thank you.
Very, very nice.